Hi friends, we are Toppers Era, make you immediate and update. We are presenting you a lecture series on dissolution testing for pharmaceuticals. You can follow us on Facebook, Twitter or subscribe us on YouTube to get more information about our latest uploads. In this lecture series on dissolution of pharmaceuticals, we will primarily discuss them through 8 videos presentations. Each video presentation will be 12 to 15 minutes. In this way, entire major part will be covered in tentatively 2 hours. There may be few more addendum video later on to clarify specific issue or challenges. In this video, we will talk about journal introduction. So now very first thing is to know what is dissolution. According to USP, a dissolution experiment evaluates the rate and extent that a compound forms a solution under carefully controlled conditions, and it is strongly expected from a dissolution method that this should have adequate discriminatory power to detect formulation changes that affects the dissolution rate of the drug product. Now, if we think about its application, dissolution test is applicable in quality control for batch-to-batch consistency and assuring quality of pharmaceuticals. It is an important CQA during formulation development and for biowaiver purpose. And dissolution testing are key parameter for in vitro bioequivalence studies and post-approval manufacturing changes. This can also be used in understanding of alcohol-induced dose dumping. Now we will talk about fundamental principle applicable in understanding dissolution. First, and a very old principle, is flux of drug across the intestinal wall directly depends on intestinal wall permeability and concentration of the drug at the wall. Second principle is rate of drug absorption depends on intestinal wall permeability, concentration of drug at wall and area available for absorption of drug. And third principle explains about dissolution from a planar surface where m is the mass, d is the diffusion coefficient, a is drug surface area available for dissolution, h is empirical thickness of the hydrodynamic boundary layer, cs is the solubility at the solid liquid interface, and cv is the wall drug concentration. There are several other equations published to study dissolution phenomena, but those are all more or less derived from these 3 fundamental equations. Now we will talk about the factors at which affect in vivo factors which affects in vivo dissolution rate. There are several parameters which affect the dissolution rate. First, we will talk about drug diffusion coefficient. It depends on radius, mass and volume of dosage form. Physiological parameters like solute concentration, temperature and fluid viscosity also affect drug diffusion coefficient. Second parameter is drug surface area. It depends on particle size, size distribution, shape and state of particle aggregation of dosage forms. Physiologically, parameter like fluid hydrodynamics is critical in drug release with respect to drug surface area. Third parameter is length of hydrodynamic boundary layer. This is also called as stagnant diffusion layer. It depends on particle size and diffusion coefficient of the dosage form. Physiological parameters like fluid velocity, viscosity and diffusion coefficient of diffusing species also affect length of hydrodynamic boundary. Fourth parameter is saturated solubility. It depends on intrinsic solubility and pK, where intrinsic solubility is expressed by molecular size, crystal properties and chemical groups of active pharmaceutical ingredient in dosage form. Physiological parameters like buffer species, buffer concentration, buffer capacity, pH, presence of lipolytic product, bile salts, phospholipids and temperature affect saturated solubility of drug. Fifth parameter is bulk concentration. It depends on dose amount, intrinsic solubility, pK and intestinal permeability. Physiological parameters like fluid volume, absorption in GI membrane, buffer species, buffer concentration, buffer capacity, pH presence of lipolytic products, bile salt and phospholipids and temperature affect bulk concentration. Sixth parameter is intestinal wall permeability. It depends on absorption mechanism. Absorption mechanism drives through simple diffusion and facilitated diffusion. Simple diffusion depends on lipophilicity, change and polarity of API, and facilitated diffusion, also known as active transport, depends on affinity of membrane channels or pumps. Physiological parameters like intestinal segment, composition of intestinal wall, number of channels or transporters, apparent permeability to mass transport affect the intestinal wall permeability, where apparent permeability may have turbulence due to intestinal wall contraction. Seventh parameter is concentration at intestinal wall. It depends on dose, intrinsic solubility, pK, permeability and diffusion coefficient. Physiologically, parameters like hydrodynamic viscosity, shear and transit time have influence on concentration at intestinal wall. So these were 7 parameters which are expressed by dosage form characteristic and are influenced by various physiological parameters given above. In vivo dissolution of drug dosage form largely depends on these parameters. Now we will talk about factors affecting in vitro dissolution. Process parameter, material attributes, and formulation variables are important to study release profile. Parallelly, for analytical method point of view, dissolution media, apparatus, and method conditions are important in study of a dissolution profile. For IBR method, it is generally expected that it should be discriminatory. The discriminatory power of a dissolution method is the ability of the method to detect changes in the drug product. Performance generally demonstrated by determining the effect of deliberate changes in the formulation or process on dissolution characteristic. Another important criteria to establish IVIVC. This is in vitro in vivo correlation. By FDA, it is defined as a predictive mathematical model describing the relationship between an in vitro property of a dosage form and in vivo response. The main role of IVIVC are to use dissolution test as a surrogate for human studies, to support and or validate the use of dissolution method and specification, to assist in quality control during manufacturing and selection appropriate formulation. And this is the end of the introductory video on dissolution. Thanks a lot for listening. Please post your queries, in comment section and follow us at Facebook or Twitter to get more update on my new videos. In next video we will talk about dissolution, understanding via USP and EP. Thank you.